Medical terms are made mostly from word parts of Greek and Latin origin. Most people proficient in medical language learn the meanings of key roots, suffixes, and prefixes early in their careers, because if you know the meanings of a few hundred of these, you can discern the meaning of many thousands of words. The root of a term is joined to the rest of the term by a combining vowel, usually O, sometimes I, E, or A. Words can sometimes contain two or more roots. If the second root or a suffix begins with a vowel, the combining vowel may be dropped, though there are some exceptions to this. The root of a word plus the vowel is called the combining form. For example, the word leukocyte is composed of the combining form leuc, meaning white, and the suffix cyte, meaning cell. Leukocytes are cells circulating in our blood, which are part of our immune system. They do not contain iron and therefore are not red. In simpler English, they are called white blood cells. Let's look at a table with prefixes, combining forms, suffixes, and their meanings. This is far from a comprehensive list, but what common medical terms can you build from some of these? Look at this slide and the two slides that follow for possible terms. If you need more time, don't worry. These same screens are captured in the handout you were encouraged to download and keep handy. Give it a try. You may already know more medical terms than you realize. Just to spice things up, the prefixes and suffixes can be used more than once, and they are not necessarily found adjacent to potential combining forms. You can create many terms from these, but do not read straight across to do it. And here's the last of my wide-ranging list. In a minute, I will show you a list of some of the terms you could have created with this table. The ability to create terms out of smaller units of meaning is a process of word formation well known to linguists. They call the smallest units which have meaning morphemes. Here is a list of some words created from the previous table. Can you discern the meanings of these terms based on the brief definitions given in the table? You should be able to get at least the gist of their meanings, though the definitions will be somewhat incomplete. Again, the list is not complete. There are still many more words that could be formed from the morphemes in the table and added to this list. And as I said, this barely scratches the surface for medical terms. Experiment with creating some more terms from the table, and then go to the medical dictionary website shown here to confirm their meanings. Sometimes the meaning of a term does not obviously explain the term but results from an interesting history behind the term, such is the case with coronary. Some patients talk about having had a coronary, and it is fairly common knowledge that they are talking about a heart attack. But the previous table of morphemes indicates koron means crown. So what gives? It turns out that early anatomists thought the arteries around the outside of the heart seemed to drape the top of it like a crown. These were dubbed the coronary arteries. It is these arteries that most often clog with fat after years of a bad diet, blocking blood flow to the heart and resulting in myocardial damage. The term coroner, referring to the medical person who analyzes the deceased body, arose because in the early days the coroner was appointed by a king to consider the cause of death for important dignitaries. And since 2020, we all learned about coronaviruses. Researchers who looked at these viruses under the electron microscope were reminded of the corona of the eclipsed sun. By the way, the study of the word origins is called etymology. Etymological dictionaries are readily available. Look for a dictionary which contains bracketed bits about the word origin after the designation for the part of speech. If you buy an etymological dictionary, believe me, it will change your mind about the words fun and dictionary in the same sentence. Let's try medical jeopardy. No, I'm not talking malpractice lawsuits. I will give you the answer and you give me the question. I will give the definition for a term based on its word parts and you ask, what is blank? For the blank, insert the term. To make it easier, I will stick to word parts shown on the previous slides. The process of treating the mind. What is psychiatry? This anatomic part pertains to an egg. What is an ovary? The condition of too much fat in the blood. What is hyperlipidemia? A condition of too little heat. What is hypothermia? A term which means removal of a lung. Pulmonectomy. This is a red-colored cell found in the blood. What is an erythrocyte? This condition of scanty urine occurs to someone who is not producing enough urine. What is oliguria? This painful disease of the nerves is strongly associated with advanced cases of diabetes. What is neuropathy? After too much exercise, many of us are prone to muscle pain. What is myalgia? Now let's go on medical rounds. This patient's past medical history is significant for hypertension, coronary artery disease, status post-coronary artery bypass grafting, and a history of laparoscopic cholecystectomy. What organ is this patient missing? Note the ectomy suffix in cholecystectomy. This patient had a laparoscopic cholecystectomy. Laparoscopic refers to observing the abdominal area internally. Cholecyst refers to the gallbladder, and so this patient is missing the gallbladder. There is a history of organic heart disease with a prior mild myocardial infarction. Other problems are those of a remote CVA with complete recovery. There is also advanced osteoarthritis of the knees and a history of chronic psychosis. The term organic heart disease indicates the patient's heart problems are due to something within the heart and not due to external causes such as hypertension or damage from medication. Myocardial refers to heart muscle. Infarct is a word denoting an area of tissue in an organ which has died due to the interruption of blood flow to the area. Necro means death. Osis means condition. Would you be likely to see this patient running a marathon? Why? Why not? The patient has osteoarthritis of the knees and so is not likely to be able to run without pain. This patient's behavior may be abnormal at times. Why? The patient suffers from psychoses. Chronic refers to repeated episodes. What is CVA? Cerebrovascular accident, a stroke. The patient has been evaluated for renal transplant and is currently on the list. His workup included a colonoscopy, which was performed and was normal. Colon means large intestine. True or false? A colonoscopy is like a plain X-ray of the colon, where the results can only be viewed after development of an image and not during the procedure. How do you know? False. A colonoscopy is not like X-ray. Term scopy implies direct viewing during the procedure. What is the common name for the organ the patient may have transplanted? A renal transplant is a kidney transplant. Principal diagnosis: rectal cancer. Secondary diagnoses: hypertension, hypercholesterolemia. What specialist would this patient likely see for his cancer? Oncologist is a cancer specialist. Onco refers to mass or tumor. Logy is the study of. True or false? This patient is also at risk for coronary artery disease. How do you know? True, the patient is at risk for coronary disease due to hypercholesterolemia. Hyper means excessive. Cholesterol is a fatty substance. Emia, presence of substance in the blood. Diagnoses: hypertension, diabetes mellitus, hyperuricemia, renal calculus, hypercholesterolemia, irritable bowel syndrome. High uric acid is a common indicator of problems with gout. Does this patient have too much or too little uric acid? This patient has too much uric acid. Note the prefix hyper in the hyperuricemia. Question: to test this level of uric acid, did they do an X-ray, a blood test, or a urine test? Why? Since we know that emia is the suffix indicating blood, it is likely that the test would be from a blood draw. What other diseases is this patient at risk for? Other possible problems the patient might develop include CVA from hypertension or myocardial infarction from coronary artery blockage. Note the hypercholesterolemia. Still considering this same patient, this patient has diabetes mellitus, which most people know by its shortened name, diabetes. In this condition, patients frequently have too much glucose in their blood. So we should not be surprised to learn that the patient probably has glycosuria and hyperglycemia. What body fluid or fluids are sampled to determine this? Glycosuria is sugar in the urine. To get this result, you need a urine sample. For hyperglycemia, sugar in the blood, you need a blood sample. Continuing with the same patient, we know from the diagnoses that this patient may have trouble at some point in the future with oliguria. How do we know this might happen? To what type of specialist might this patient be referred for his oliguria? Renal calculus is a kidney stone. Renal refers to kidney, calculus to stone. In the future, the patient may have urine retention due to a blockage of a ureter by a kidney stone. Oliguria, or lack of urine, can be due to either low urine formation or urine retention, according to Tabors. If the patient suffers a blockage, he would be referred to a urologist. For a kidney which does not produce urine, he would see a nephrologist. How about his diabetes mellitus? For diabetes, he would be referred to an endocrinologist. How about his irritable bowel syndrome? For irritable bowel, he is likely to be referred to a gastroenterologist. To continue this exploration, I recommend a couple of potential routes. Some community colleges offer courses in medical terminology. The best text in my experience for learning medical terminology is The Language of Medicine by Davi Ellen Chobner. If you are interested in a printed dictionary, here are some recommendations. Dorland's, Stedman's, Tabors Cyclopedic. And finally, because humor is probably the most important tool in our toolkit, I leave you with this.